In a nursing home, a call light should never be just a sound in the hallway. Behind every light is a person, a resident waiting for help, a resident trying to explain a need, a resident hoping someone comes before the need becomes urgent. But traditional call lights often give staff only one piece of information, a room number. They do not say whether the resident needs the bathroom. They do not say if the resident is in pain. They do not say if someone needs water, linen, repositioning, or urgent assistance. They do not show priority. They do not always show who accepted the request. And they do not always make it easy to know what was completed, what was delayed, or what still needs attention. That is where CareCueD changes the story. With CareCueD, the resident has a clearer voice. Instead of pressing one blind button, the resident can choose what they need, using simple, large, easy-to-understand options: bathroom, pain, water, linen, help, repositioning, urgent assistance. The request is no longer hidden behind a light. Now the care team sees the need clearly. Room 215, bathroom assistance, new request. A CNA receives the alert and knows exactly what to prepare for. The request is accepted. The timer starts. The task is tracked. And when the care is complete, the response is documented. This is not just faster communication. This is safer, smarter care coordination. When a resident reports pain, CareCueD can route that concern differently. Pain may need a nurse. Pain may need assessment. Pain may need follow-up. With CareCueD, clinical needs can be escalated to the right person instead of being buried inside a general call light queue. Pain request, room 104, high priority. The nurse sees the request. The resident is assessed. The concern is addressed. CareCueD helps make sure the right information reaches the right caregiver at the right time. For supervisors and administrators, CareCueD creates visibility. They can see open requests. They can see delayed requests. They can see escalations. They can see response trends. They can see where support is needed before small problems become larger ones. CareCueD does not exist to blame caregivers. It exists to support them, because caregivers need tools that match the reality of long-term care, like busy hallways, multiple residents, urgent needs, limited time, and high responsibility. CareCueD gives staff clearer direction so they can respond with confidence, compassion, and accountability. For residents, CareCueD means being heard. For caregivers, it means less guessing. For nurses, it means better visibility into clinical concerns. For supervisors, it means stronger oversight. For facilities, it means a clearer record of care requests, responses, escalations, and completed follow-up. And for families, it means greater confidence that their loved one's needs are not disappearing into the background. Resident Request CNA Nurse Supervisor Administrator CareCueD turns the call light process into a complete care communication loop. A need is submitted. The right caregiver is notified. The response is tracked. Delays can escalate. Completion is documented. Leadership can review the outcome. This is how facilities move from blind call lights to clear, prioritized, accountable care. CareCueD by MediSyncD Technologies, LLC, was built with one mission: to protect residents, to support caregivers, to strengthen communication, and to help long-term care facilities deliver the level of care every resident deserves. Because every resident matters, every request matters, every response matters.